Hello friends, my name is Sonal Chandalia. I'm the Chief Nutritionist at Dr. Chandalia's Diabetes Endocrine Nutrition Management and Research Center and the Director of Denma Healthcare Private Limited. Today we'll be discussing the lifestyle management of obesity in diabetes. We see that many people may be having obesity issues along with their diabetes, and there is weight control or weight loss required. What is important to understand that when you look at it from the diet perspective is that we aim towards having a lower calorie diet called a hypocaloric diet, which may usually be minus 500 calories from your present diet. This of course has to be a balanced diet all the way through, and there should be no fad diets that should be tried because they will never be successful in the long term. Additionally, we also need to consider that what we're looking for is not only weight loss, what we're looking for is to maintain the muscle mass and to only allow fat loss. Hence, the maneuvers that are tried, and many of them have been tried over the period of time, need to take this into consideration to have a healthy kind of weight loss. We do use the lifestyle intervention towards weight management or weight loss. We need to take into consideration that apart from the diet, the exercise plays an important role in keeping the muscle mass intact and allowing more of the fat loss. Hence, most of the regimens or most of the trials that are done, we see that the adjunct of diet and exercise works better in minimizing obesity or causing or bringing about a weight loss in the form of fat loss in a person with diabetes. So in obesity with diabetes, when we do the diet plan or the diet that one is following, needs to take into consideration that it may be a lower calorie diet, a calorie restricted diet, but it is yet a very well balanced diet. The carbohydrates have to be complex carbohydrates of whole grain, cereals, pulses with high fiber. Additionally, so that it helps protect you from the other risk factors also. And you have to completely cut out the simple sugars or the direct sugar intake so that those calories are not adding into that caloric diet. We also consider the protein intake. When a diet for diabetes is being planned, but along with it there is also obesity, we need to take into consideration that person may have hunger pangs, maybe on a lower calorie diet and therefore have binging and craving. Hence, the particular diet being a little higher on protein with the right quality of protein, which is 50% from animal source and 50% from the plant source protein, is required. The animal source protein has to be lower on fat, so more of the lean protein, as well as from the plant origin has to be more of legumes, pulses, beans, so that they contribute to also giving fiber along with the protein that they are giving. Taking this, we also need to take into consideration the fat intake of that particular individual because the person is trying to do a fat loss regime. In that process, we need to still have the right quality of fat apart from the right quantity of fat, which will not only be heart-friendly overall, because a person who has obesity and diabetes is also more prone and at risk to heart disease. Considering all the risk factors in this situation, when we are trying to bring about any kind of weight loss or fat loss, we find that the right quality of fat will be more the monounsaturated fat, which will be on a rotational basis, where a person may consume 1 teaspoon of ghee or butter, which is always allowed through the day, even on a low-calorie diet. There are monounsaturated fats as cooking oils, and there is some small component, which is the nuts in the form of walnuts to give the omega-3. This also brings about greater satiety in the entire diet for that individual and therefore curbs their binging and craving. When we are considering how to help a person with obesity and with diabetes, remember that the challenge is not only to lose the weight, but to keep that weight off. We find that if one even achieves up to about 7% of weight loss from their current present body weight, you will find that it goes a very long way in reducing the risk factors by more than 45%. And that is huge in the long term. So there is a good prevention that is possible along with that weight loss. Also, the flip side is that a person who may manage to lose weight by whatever means, even if it's not a balanced diet, through fad diets, etc., the challenge lies that in the first 3 years, the person tends to regain that fat and that weight and therefore lands in a yo-yo mechanism. So when there is obesity with diabetes, where the blood sugar control is also very important, none of these fad diets should be tried because the sustenance of that weight loss is very important and you stabilize over about a period of 3 years and after. Hence, please do not opt for any fad diets when you're trying to treat the obesity with the diabetes because your blood glucose control along with your weight loss all has to strike a balance in your system. So when we're planning a diet for a person with obesity in diabetes, we find that the person's lifestyle has to be taken into consideration. We travel, we eat out, there's restaurant dining, there are a lot of packaged foods that are consumed. So there is an education required on this. So it is very essential that this is also done when you're going into a weight loss regimen or anyways trying to help yourself to lose weight. And you have to understand that there are a lot of hidden sugars in the labels of the food that are processed foods and the packaged foods. You need to realize that these may be also contributing to your weight gain. And additionally, what are the food options and choices that one should take when they are going on a calorie-restricted diet and trying to lose weight with diabetes? In a step towards helping yourself, make sure that you do not land up having high amount of fat or high amount of direct sugar. The method of cooking becomes very important. It plays an important role that one can opt for the methods of cooking which need less oil, like steaming, sauteing, boiling, broiling, instead of doing anything which is deep fried. When a person has obesity with diabetes, we are and maybe even sometimes some other risk factors, but essentially an effort is made to lose the weight or the fat loss. The kind of exercise that is undertaken also is very important because we want to keep the lean mass intact or basically your muscle intact. Towards this, we have the cardiovascular exercise where you again follow the FIT rule where the frequency should be about at least 5 days a week. The intensity should be mild to moderate according to your capacity and advice. The time period that you undertake that exercise also has to be fixed so that it is meaningful, and also the type of exercise, in this case being cardiovascular. Additionally, the component of a resistance exercise also has to be built in because that helps your muscles, and with yoga there can be some flexibility. Remember also additionally that apart from all this, you need to follow this on a regular basis so that you achieve maximum results according to this, and your lifestyle is therefore with the diet and the exercise to achieve that particular fat loss. If an individual with obesity has difficulty really being very mobile because of the weight or because of any other issues, we also have the exercises like non-weight bearing exercises, which can be like a stationary cycle or swimming, which still offer you the cardiovascular benefits, and yet at the same time, your own body weight works for you and you're able to undertake these exercises even if you're overweight or obese. So we can see that there is a comprehensive and holistic plan that is required when we do lifestyle management of obesity with diet and exercise. So thank you for listening in, and we look forward to the next episode.